The overall aim of our project was to set up a perioperative pain clinic whereby patients with complex pain needs would be seen before elective surgery, and we would support them in potentially reducing their opioid load and providing any other supplementary pain management support in terms of education. The reason we were doing this was because prior to QLab support, the pain consultant was the only person giving this service, and the wait for a contact time with the consultant was 8 months. So we aimed to reduce this time. Because the patients were being seen before their elective procedure, this could have a knock-on effect for their wait for surgery. One of the main takeaways really is that we have fully embedded a perioperative pain clinic into our service. It's a nurse and pharmacist-led clinic, which hasn't been done before. We have helped a lot of patients successfully reduce their opioid load prior to elective surgery. The feedback we've had from patients has been really good, and staff have really liked the change as well. We've also successfully reduced the wait time now from referral to the patient being seen from 8 months to around 23 days. So that's really positive. Another challenge was getting the understanding and the rationale for setting up the service across 2 different specialist areas in the hospital, and also really maintaining the interest in the service. So one of my deepest learning points was the true value of interpersonal relationships. I was very naive coming into this process, thinking that a few emails here and there would help build relationships with people and make change happen, and it just really doesn't. So just building those one-to-one relationships with people, getting to know them really helps get them on board and make change happen. The other learning point that I have found, especially over phase 2, has been making the initial change is one thing, but maintaining it is another. And that has been very up and down. The next steps for us will hopefully just be embedding the service into just a routine pathway for patients. We also would like to embed some psychological therapies for our patients, but as we found in phase 2, that does have its challenges. So that will be something that we will continue to work with and work on. To anyone who is looking at doing something similar is to keep positive, because even the slightest setbacks can really make you think, what are we doing this for? So it's really important that you remember why you're doing it and the impact it can have with your patients. I think I'm most proud of the way in which our team has adapted. We are quite a small team anyway, and we all have our day-to-day roles, and it could be seen that this is an additional stressor, an additional role for us. However, I just feel like we have supported each other quite well throughout this, and we've had each other to lean back on and discuss certain challenges with. So teamwork, I think, is one real big area that I'm proud of us for.